Hey, Pathophys. This is a special edition, so to speak. I got a number of responses about the assessment that's due tomorrow, which would be Saturday, April 18th, on the muscular system. And I wanted to address a few things. In fact, I wanted to go through the answers with you. I'm not going to post this until either right before it's due or right after it's due. I do want you to go on there and listen to this video. I'm going to make this really short and sweet, give you the answers, kind of some explanations for those of you that are struggling, because a few of you, as I mentioned, had expressed some difficulty with the assignment. So we're looking at the muscular system. Obviously this is pathophys, it's not anatomy, but you have to understand the anatomy of the muscular system. I describe how a muscle fiber contracts from the time that the nerve impulse is generated in the brain, from the time to the time that the muscle fiber actually shortens. What's happening along that way. And I just want a basic answer here, and I don't think it's anything out of the realm of what we taught you last year, some of the things that we did in class even this year a little bit. So what basically happens, nerve impulse is generated, it's going to travel along the axons of the neural fibers, along the neural pathway to the muscle that it is going to. Along the way, the nerve impulse will depolarize the membranes of the neurons, individual neurons, and this is going to cause the flow of electricity to occur. This is the force, the nerve impulse, the action potential, so to speak, that pushes the nerve impulse from point A to point B. That's how it gets to the muscle fiber. Once it gets to the muscle fiber, a number of things happen. It has to get through the muscle fiber itself. The outside membrane is called the sarcolemma. The T-tubules are the openings in the sarcolemma that the nerve fibers will penetrate and send the nerve impulse into the nerve fiber. Once it gets into the nerve fiber, that causes calcium. That causes calcium to be released. And when calcium is released inside of the nerve or muscle fiber, then actin and myosin can bind. At that point, we still have to have one more factor involved, and that would be energy. Energy in the form of ATP has to be broken down so the muscle fiber can contract. So basically, nerve impulse moves, gets to the muscle fiber, calcium gets released, actin and myosin, the two muscle proteins, bind together. This is your whole sliding filament model. And then the shortening occurs when we add a little bit of energy into the equation, which is ATP. That would be the answer for the first question. Second question, disease A presents with myalgia, cramping, fasciculations, and bradycardia. A blood test shows that serum calcium level, a serum calcium level, 3.0 milligrams per deciliter. What is disease A? Describe the pathophysiological mechanism. Disease A is hypocalcemia. Hypocalcemia is a disorder in which obviously you don't have enough calcium. And my explanation for question number one should make this all the more clear. If we don't have enough calcium in the muscle fiber, then we can't bind actin and myosin together, and then we can't have muscle contractions occurring. So what do you see in a patient that's hypocalcemia? Since there's not enough calcium to allow the actin and myosin to bind together, you see muscle cramping, you see twitching, you see them not working properly. In severe cases, hypocalcemia, since the heart's obviously muscle too, can cause cardiac arrest. All right, question number 3. Disease B presents with extreme fatigue, muscular weakness, myalgia, and exercise intolerance. This is a disease at the level of the organelle. What is disease B? And describe the pathophysiological mechanism. This is what is called a mitochondrial disorder or mitochondrial disease. Patients that have this, and there's a number of different ones, we'll just lump them under one umbrella. Patients that have this disorder, their mitochondria don't work properly. They're not functioning. So if you think about a cell phone that has a battery that no longer charges properly or loses its charge real quickly, it's kind of the same effect that you'll see, except for it could be more gradual in a person. Again, it's a metaphor, but just so you kind of understand, they cannot process energy properly. Their mitochondria, which is the powerhouse of the cell, is not releasing energy properly or enough. So these people, as I mentioned, with the symptoms and signs you're going to see: extreme fatigue, muscle cramping, myalgia. similar to the hypocalcemia in some regards, but this is an energy disorder. This is the disease in which patients can't process their glucose properly, so they're not going to have the energy needed to cause muscle contraction. So if we look back again to that first question, I put that question there for a reason, preceding questions 2 and 3. In one case, we don't have the calcium in place, which allows the actin and myosin to bind together. Those people probably have plenty of energy. And in the second case, calcium might be in ample supply, but what you're not going to have is the amount of energy needed to make the muscle contract. So the net effect's the same. The muscle's not going to work properly, but it's for 2 different reasons for number 2 and 3. All right, question number 4. Disease C presents with numbness or tingling in the extremities, ataxia, vision problems, and paralysis. It is episodic and progressive, and signs and symptoms vary from person to person. Basic explanation of this disorder is that its nerve impulses are not being transmitted effectively or at all. What is disease C? All right, disease C is multiple sclerosis or MS. In this disorder, the muscles are in fine shape. They work just fine if they get the proper stimulation from the nervous system, which they don't. Because in multiple sclerosis, which is an autoimmune disorder, the white blood cells attack the Schwann cells, which are the cells that surround the axons of the neurons. Those are the insulating properties or the insulating mechanisms for the neurons. You have to have that unimpeded flow of electrical force, the nerve impulse. So as soon as that starts to break down, it's like stripping plastic off of a wire. It's going to short circuit. So that nerve impulse that might be generated in your central nervous system is not going to make it. It's not going to get to the muscle fiber. And that obviously is going to cause some problems, or it's going to get there in interrupted spurts. So you'll see some of the symptoms and signs if you look into MS a little more deeply, but that's MS. So that's a disease, not so much in the muscle, but it affects muscle function. All right, disease X presents with drooping eyelids, facial paralysis, difficulty walking upstairs, and dysphagia. What is disease X? Disease X is myasthenia gravis. Myasthenia gravis is a disorder that affects the neuromuscular junction. So the last disease we talked about affected the neuron itself, which was taking the nerve impulse to the muscle. This is affecting the portion where the nerve and the muscle interact with each other, which we call the innervation point. So when that nerve hits the muscle fiber, it's no longer, it's that junction is disrupted. It's broken. If you think of a cord that's plugged into an appliance, a hairdryer or a toaster, if it's broken right where it plugs in, the appliance isn't going to work. So you have the same, again, net effect. You're not getting nerve impulses into the muscle, but it's right at that junction point. This is autoimmune as well, and typically is not as bad for the patients as prognosis as MS is, even though MS's prognosis has improved greatly over the years because of the understanding of how to treat it. But in myasthenia gravis, what we're going to have happen is, again, we're not going to allow that nerve impulse to properly interact with the muscle fiber. So that's what you see the symptoms, the facial paralysis, the drooping eyelid. I think I mentioned in my last lecture that I had a student that had this disorder about 10 years ago, and he started getting what he thought was a lazy eye. His eye wasn't working properly. He was having a hard time focusing. It was drooping, and he had the beginning stages of myasthenia gravis. With some treatment, he recovered almost fully within a couple of months. So I hope this helped. Again, understand the purpose of this. It's not so you guys can go through and plug and chug and just answer question A, B, C, or D. It's so you have a better understanding, a better overall ability to look at these diseases that I'm giving you and try to figure out how they work and what they are doing to disrupt homeostasis. Talk to you guys next week. Have a good weekend.